So here are 5 things you should do while studying for the NCLEX. Number one, don't joke with your safety because NCLEX like safety, patient safety, bed rails and medication administration, checking if the patient's name, patient's date of birth. Second thing that you're not meant to joke with on the NCLEX is infection control, your personal protective equipment, aseptic technique. NCLEX does not joke with these sort of things, so pay closer attention to these things while studying. The number three thing that NCLEX does not joke with is prioritization. NCLEX doesn't joke with prioritization. They always ask prioritization questions. I think I got nothing less than 10 prioritization questions. So NCLEX does not joke with prioritization questions. Take notes. Okay, so number four is application. Applying what you've read to real case scenario. Sometimes this can be a very big problem, so you need to bridge the gap. That is when the question bank comes in. When you are reading the rationales of the question bank, don't read it or don't cram it for cramming sake or don't just know the answer for name sake. Read the reason why the answer was chosen. It will help you even in other questions. So when you come across other questions, you will think like the NCLEX thinks and you will know how to answer that question. So number five is very, very important. Do not use many resources. Do not use many resources. You will end up confusing yourself. So initially I had some that I had simple nothing. I had a lot of materials that I was using to bombard myself. But at the end of the day, what worked for me was simple nothing. And I want to let you understand that what works for you might not be what works for another person. But what worked for me was simple nothing. It was really understandable and it made so much sense to me because I'm a picture person. Once I see a picture, like it sticks more. And Simple Nothing has a lot of picture. They have a lot of mnemonics that will just help you. It's very easy. It's the way the name is Simple Nothing. That's the way it's simple. It made so much sense to me. Um, Now for the question bank, U word and necklace, both of them were very important to me. U word made me understand, like the rationale made so much sense, as well as necklace. But U word is more in depth here. I used U word for 3 months and I used necklace for 1 month. I said 5 points, but this point is also very important. So just see it as an extra point. Study your weak areas. There are some areas that you will come across and you know that this area is kind of difficult for me. Make sure you study them. Go back and study them. I had issues with ECG, and I went on and I was just watching videos, going about. I was looking for videos. I was scrambling through videos on YouTube. I kept on watching videos on ECG. At the end, guess who saw ECG in her exam? And I don't mean just like questions. I mean like with pictures. So imagine that I hadn't studied or I hadn't gone through YouTube videos. Let's not even imagine that. So go through your weak areas. I believe we have come to the end of this video. So I hope you guys study for the NCLEX, use good resources, and I hope you pass in one sitting. Thank you and have a nice day.